11:12 in the morning. Welcome back live with Congresswoman Katherine Clark on OTR.
Congressman, House Speaker Pelosi wants a bipartisan committee to oversee all of the government's spending during this pandemic. She says, quote, "Where there is money, there is mischief." The president and the Republicans are calling this nothing but pure politics. But let's face it, they do have the votes in the end. Do you think anything is going to happen?
I do. I think that she is absolutely right, that where we see $2.2 trillion going out in really an unprecedented piece of legislation, we have to be sure that that money actually goes to the people who need it, to the people who run stores on our main streets, to families who have lost jobs and still see the bills rolling in. So it is our responsibility not just to look backwards when this is over, but in real time to make sure that we are getting the funding to where it belongs, which is with the American people.
We are at the very beginning of this journey, of course, but do you suspect or have you seen any evidence of mischief?
We have. We have seen people who claim to have large availability of protective masks and bid up those masks and take orders, and then those orders just simply are never filled. We are seeing lots of price gouging and other sorts of fraud that happens when you have this scale of demand for anything that can help protect our frontline workers, our healthcare workers. So we are very aware of that, and we want to be sure that we are also going forward with the oversight on the part of this package that went to private business, $500 billion to help airlines and other businesses during this crisis. And it's our obligation under the Constitution that we do this type of oversight. I frankly can't imagine why there would be resistance from across the aisle to making sure that this money is well spent, that it doesn't fall into the hands of those who want to use this health crisis for their own profit. But I think in the end that cooler heads will prevail, and there will be bipartisan support for this commission.
The CDC is now advising that everyone wear non-medical masks for face covering. This has been a homemade mask that I have. Now, we've seen much more of them locally this weekend, no matter where you go. President Trump says that he will not wear one since it's all voluntary. I noticed when you arrived this morning, you didn't have one. You have one now. Will you wear one?
Well, I do have one in my car,
yeah.
and I did have to go to the grocery store yesterday, and I did wear one. I think that, like everything in this crisis, we need to listen to the scientists. We need to listen to the medical experts. The president has mischaracterized and promoted many very harmful, potentially dangerous ideas. And we are being told that wearing a mask, even if it isn't of surgical grade, that can be helpful. We don't know exactly how this disease is spread, what exactly may be safe distancing. So let's listen to the best advice we have, that we keep at least 6 feet apart, that we wear a mask when we're out in public, that we continue to wash our hands, sanitize, and wipe down areas in our homes to keep us safe. That is how we are going to get through this as a community, doing these isolation, social distancing, and I have to say that it is incredibly inspiring to see how communities are coming together. Mm-hmm. We understand that if we are fortunate, our families may not be touched directly by this virus, but that our communities are suffering. And many people have already lost loved ones, and many others are very gravely ill. So these are the small things we can do that add up to saving lives and making a difference in how soon we can get back to opening our businesses and economy.
Congresswoman, thank you so much for coming in this morning.
Thank you.
Be well, and I hope your family stays well. Great to have you with us this morning. Congresswoman Katherine Clark. The Sunday Roundtable is next here on OTR. The DNC has moved its convention because of the coronavirus. Our question, is it time to go virtual with the convention? Stay with us.